Hey there and welcome to Concierge Medicine Radio, your source for actionable advice and real stories of physicians running and growing concierge practices. For more interviews and notes on today's show, please visit conciergemedicineradio.com and enter your email. Now, let's join your host, Taylor Pearson.
Hey there and welcome to another episode of Concierge Medicine Radio. Excited to be back with you today and bring you an episode with Dr. Ryan Neuhofel of NeuCare, a direct primary care practice in Lawrence, Kansas. Dr. New started his practice of direct primary care straight out of residency a little over 2 years ago and has been growing it ever since into a successful DPC practice where he's able to care for his patients the way he believes they deserve. So this is an interview we recorded towards the beginning of this year, but Dr. New shares a lot of great information about how his practice is set up now and what he's done over the last 2 years to get to the point he's at. So talks about how he's been able to use local speaking engagements to inject his passion for his practice and bring in over 30 new patients per month, how he structured his practice to keep overhead low in order to offer the best possible value to his patients. The two biggest causes of failure he sees in other physicians that transition or try to transition into a direct primary care or concierge model and how they can be avoided, and why he believes you should start marketing your practice 6 months or a year before you ever open and not the day of. Also, I want to take a minute here and thank everyone that took the time to leave us a review on iTunes. It does help get the word out, and we appreciate it. So we got a review from Sinister MD recently. He says, "This is a very good overview of what DPC is all about and what it's trying to accomplish. There are many myths out there about what DPC, direct primary care, or concierge medicine is, but this podcast does a good job of explaining what the movement is trying to accomplish. Patients, physicians, businesses, and insurance companies aren't happy with the current system." So thank you for your testimonial, both to what direct primary care and concierge and private medicine as a whole is trying to accomplish, and the podcast. So if you do enjoy the show, we appreciate if you take the time to leave us a review. And without any further ado, let's get into the show with Dr. New.
When I opened my practice, I started totally fresh in a new town. I had no reputation as a physician or anything else and had no connections. And so really, it just started with, as I planned to open my practice, to go around and talk to individuals and groups about my idea and what I was wanting to do and why it was going to be good for them. And so that's really kind of a guerrilla grassroots campaign, if you want to call it that, selling the points of direct primary care. And so I didn't really do a lot of marketing. I basically just went around and actually volunteered at a safety net clinic here in Lawrence and got to know them very well. And so received a large number of referrals from them, mostly uninsured people. And so as I built my practice, it came from a variety of different sources. But in the beginning, and still now, 2 years in, the majority of people who find my practice and sign up are people who are uninsured and typically middle income or lower income and really don't have a lot of other great choices. So I offer all of the services and amenities that a concierge doctor does, but I don't call it that. In fact, my population, I joke all the time that my clinic is a concierge safety net.
So what services do you offer then? Or tell us kind of how your practice is structured in terms of services, pricing.
Yes, for sure. So I'm a family medicine doc, board certified in family medicine. So I practice the broad spectrum of primary care services. I pretty much do anything as an outpatient except for obstetrical care. I don't do pregnancy care. But other than that, I have practiced the full spectrum, all ages, all common medical conditions, acute care, things like procedures, stitches, broken bones, so minor and minor urgent care and emergency care I do as well. But in terms of the way that my business works, we work on a monthly membership fee that covers the vast majority of services that a person would ever need for their healthcare. And our membership fee for individuals is $30 to $50 a month based upon age. So people under 30 are $30, and then people over 60 are $50 a month, and then middle-aged people are $40 a month. And then we also have a family plan that gives people a pretty hefty discount for signing up whole family as a group. And for that membership fee, like I said, we basically do almost anything anyone ever needs. It provides access to me 24/7 by phone, email, text message, and includes all visits without copays during regular hours in the clinic. I do as many visits and as long as anyone needs without charging anything in addition to that. And we also, for the membership fee, cover most routine lab services. So, in-house testing, point of care testing, like strep testing, urine testing, and then also a lot of more extensive lab work, like we do cholesterol testing, blood counts, A1Cs, TSH for no additional charge at all for our patients. And procedures we basically do either for free or at cost of supplies. So some procedures there's no charge for, others maybe $10 or $20 for the cost of the suture or steroid that I inject. We do have a few small fees for things like house calls and after-hours visits. And then probably the biggest benefit to our patients is anyone who's a member of our practice gets access to a host of cool things at wholesale price, including labs that aren't included in the membership and also medications. So I buy wholesale medications and sell them at cost to our members, and oftentimes can save people 70-80% on their medicines. And the savings in that oftentimes is much more than a patient ever pays me in a membership fee.
How many patients do you have right now?
We are in the 600s, almost 700 patients active right now. My goal is around 800 patients. And I think that's a pretty good balance. And a lot of concierge docs, take 400 to 600. So my goal, again, was to make things as affordable as possible. I want to maintain total access to us and same-day visits, but I also want to make things affordable. So we kind of decided on a number of around 800 was something that we could do and do well and still maintain same-day visits and open access to us at all times. And so we're pretty much at our goal right now and planning on bringing on another doctor in the near future.
So how many patients are you adding per month then? You started in December of 2011?
2011. Yeah, on average, I would say of new members, we've averaged most months over 30. We've had some months with 40, 50, or 60. Our turnover has been a little bit higher than what I would like, mainly because we're working for the most part with a lower income population. So our turnover rate has been a little bit higher, but I think there's very few months we've ever had less than 30 new enrollments.
That's a pretty impressive rate of growth. What you said you were going out into the community. What exactly were you doing to be able to acquire patients that quickly?
It's taken many forms. A lot of it is just speaking to local organizations. I live in a college town, which is, has a lot of active community groups, things like Rotary Club and various business organizations, other things that have nothing to do with business or healthcare, and just going around and talking to people and really preaching the gospel of direct primary care. And it's really interesting, all the different audiences that I've gotten. I take pretty much anyone who will listen to me. And sometimes it's some type of nonprofit organization that's doing a lot of social services, and sometimes it's a group of some wealthy business owners. And so really what we found is doing those type of things has been the most effective because people want to know me. Healthcare is a personal thing. I know some people find benefit in doing traditional marketing, and we really haven't. We experimented with a few things in terms of advertisements or paid marketing, but for the most part, we found that not to be very effective. And, just meeting people and hosting events, like we've done some public education things where I'll give a speech at the clinic and talk about allergies or the benefits of yoga or any other topic we can dream up. Invite the public to come in and see our clinic and get some refreshments and some health education. So those type of things, those kind of community things have for us been a lot more effective than paying money to a newspaper or a radio or anything like that.
So did you just sit down with the phone book and pick 20 business organizations and start cold calling them and saying, I want to come talk about direct primary care? Or
Yeah, I guess so. I mean, in the beginning, obviously, I didn't have a lot of connections to this town. I had some friends who lived here. My wife went to pharmacy school. But, a lot of it was just pounding the pavement. And, as I got to know people, they were passionate about what I'm doing and believed in it and introduced me to other people. And kind of like any person who starts a business, you have to network and as you get to know people. But, some of it was cold calling, but most of the time it was introductions. And one person was involved in this club and they said, hey, I have this other organization that I think would be a really good forum for you. And it really wasn't anything magical or anything different than any other business typically does. I guess the only unique thing is most of the time a physician is not willing to go around and do that.
And what were you speaking about? Just the benefits of direct primary care, or was it general education?
Most of the time, it was related to why people needed to join my practice. Much of the same elevator pitch that I just gave there was said, in many different locations. But most of the time, it was just answering questions. People are very unhappy about healthcare, but in some respects, they're very complacent. Both physicians and patients, I would say, are kind of miserably complacent. And so a lot of times, it's just introducing the idea and telling people there is a better way. And so in order to kind of convince them of that, you kind of have to be there in flesh and blood and say that this isn't just some theory. This is something that is happening. And so being in front of someone and talking to them about the idea and answering their questions is way, way more powerful than, them reading a little quarter-page ad in the newspaper. So people, like I said, they're miserably complacent about healthcare and they want better and they think that things should be better, but they don't know how that can be possible. And so whenever I introduce my idea, sometimes I've had people frankly tell me that's too good to be true. And I've had people join my practice who knew about me for a long time and eventually decided to join because they had heard from several sources that this was a real doctor and it was a cool thing. And I had several patients say, I knew about you and actually had looked at your website and I had, read an article about you, but I honestly thought it was too good to be true. They thought I was some type of crook or a quack or something that just wasn't possible for me to do what I'm doing. And I've actually had several people frankly tell me that. They just didn't think what I was doing was possible. And so they thought there must be something wrong. After over the last 2 years, got enough patients that obviously have been able to dispel that myth. But I think that it comes back to the point that people are miserable about their healthcare, but they're kind of used to doing it that way, and breaking through to people that stop and think about what you're doing and what you're paying for and what you're getting is very difficult. It's a very large mental barrier that a lot of people have. So, you kind of have to be willing to go out and talk about the direct primary care and why it's good.
So I want to come back to that and talk a little bit more about the economics of your model. But in terms of speaking to these organizations, normally those, in my experience at least, those organizations don't want people to come in and give marketing and sales pitches. Did they let you come in just because the model kind of sold itself? It seemed so attractive, they saw the benefit, and so they were willing to let you come in and give your spiel, or how did you negotiate that with them?
Honestly, most of the time it was an invitation. I truly am trying to provide a really high quality of healthcare, but I'm also helping a lot of people. So this is not a totally altruistic venture on my part. This is my business. I'm very willing to work for free and volunteer my time, but this effort that I'm doing is my business. And so it is a private business. But I think a lot of people understand the good that we're doing for the community, even if I'm not a quote unquote nonprofit or have some kind of flowery social mission. But I think it's pretty evident what we've done in our community that people are open to hearing this. And so, yes, it is a business. But I think a lot of people in my town have kind of realized the good that we do. And so, in some respects, I think a lot of people do view this as some type of social safety net clinic or something along those lines. And so that in some respects helps that people understand that we're trying to do good, but by doing good, I'm also paying my bills and running a business. And so I think that's probably a little bit of a distinction for a physician who does have a mission that, I'm not selling used cars at these organizations. I'm talking about healthcare and the healthcare system and answering people's questions, even if it's not related to my practice and even if they don't think they want to join. I just like talking to people about healthcare and health insurance and these topics that are very confusing to patients. So a lot of times just having a physician who's willing to come and talk to a group, I think a lot of people are taken aback by that and are just like, you're really going to come to a physician? You're going to come here and talk for an hour and just answer questions for free? I think a lot of people are just like, oh, sure, a doctor will come in and talk to us, whereas most doctors are not willing, capable, or whatever of doing those type of things.
Yeah, sort of education as marketing. It's not marketing as you think about it in traditional advertising. You're going into the community and you're educating people. And once they become educated, they kind of see the clear benefits of the service you're providing.
Yeah. Yeah, like I said, it isn't altruistic, so I do have a philosophy that obviously benefits myself, which is not a bad thing. But yeah, to me, I view it as I just want to educate people. And if nothing else, have people stop and think about their healthcare. We are very ingrained in the way that we think about health insurance and healthcare. And so just if I can have people stop and think about it, and I can't tell you how many times whenever I start speaking to a group, they're looking at me like I'm a crazy person and scratching their heads. And by the end, they say, that actually makes a lot of sense. But people have kind of been, I don't want to say fed lies, but people have been invested in the current system and so emotional about it that they can't stop and think about the big picture. And so to me, like any opportunity to do that, and obviously I have a business interest in doing that, but to me, that's the main reason I want to go talk to people.
Well, let's talk a little bit about the business side of it then. Could you kind of compare and contrast for us the economics of how your model works versus, say, if you'd taken the traditional path and you were working for a hospital now?
Well, in terms of the business finance, the difference is enormous. And the main difference is overhead, because we don't do any insurance contracts or billing or paperwork or anything along those lines. My operating costs and overhead are a fraction of what a insurance-based physician's office would be. And so that's really where it all starts. And I am a cheap guy. My wife calls me that. And so we really think about what stuff costs, because the more that we have to spend to do business, the more that I have to charge people to make a living. And so if we can lower our overhead as low as possible and keep our staff lean, and it's just me and one other person and a nurse who works at the clinic, my take-home pay as a percentage is much, much higher, and my overhead is less than half of what a traditional physician's office. So that's how I can charge my rates, which some people, again, are skeptical of. Like, how could I charge $30 to $50 a month and provide all of these services and do all these labs, which people typically pay dozens or hundreds of dollars for? But it really comes back to being a lean, efficient business and keeping our overhead really low. And by doing so, we can offer reasonable rates. And like I said, this is something that is my livelihood, and I am making at least average for a family physician, and probably will make a little bit more than that, actually. But really, the business model only works because of the overhead being so low.
So 18 months or 24 months out of your residency, you're at or above typical take-home pay for a standard physician, charging $30 to $60 a month, you said? $30 to $50 a month. I think some people, I find that hard to believe still to an extent, because it seems so contradictory to what you hear. But
yeah. Well, no, really, if you think about it, you can do the math yourself. So if you add up our average, it's not complicated. It's math. If you add out what our average monthly membership fee is, which is between $35 and $40 a month when you add up all the fees, because we give discounts to families. And so if you add it all up, our average monthly fee per patient is about $35, $37, somewhere in that range. And so it's $350,000 range. I'm taking home, my overhead is only, my operating cost is about 30%, including my employees and everything. So my take-home pay is about 70% of that. And so it's really simple arithmetic. And the reason that people can't fathom that is because to do business in the regular system is ungodly expensive. So I don't need to take home I don't need to get a revenue of $1 million for me to make $200,000. I only need a revenue in the $300,000 to take home $200,000 a year. And so really, I have other physicians who say the same thing, like that is not possible. Like I have also people who think I'm some type of saint and I'm taking home $30,000 a year. But the reality is all about overhead. And if your overhead is low, any person, any other business can understand this concept, that if your operating costs are low, you don't have to charge as much. And so really, if you do a calculator, it comes out pretty simple.
Right. The business model is kind of what makes everything possible.
Yeah, of course. Yeah, I mean, you couldn't just take a normal office that has 5 support staff per doctor and charge $30 to $50 a month, because you're paying an entire support staff more than what the doctor gets paid. It all comes down to your operating costs. And if your operating costs are low, again, my overhead is probably around 30%-ish. And probably will get lower. Hopefully with time gets lower as we get more efficient. The normal doctor's office overhead is 60 to 70%. And that's probably an efficient practice. Some are probably 75 to 80% operating costs. And so the doctor, someone pays $100. I know everyone thinks the doctor takes home $100. They're probably taking home $20 or $25 in the regular system. Whereas us, I take home $70 out of that 100. And that's all that really matters. I want to be able to make a good living. And if I can make my overhead low, then I don't have to charge that much. So yeah, it's pretty simple, really.
What are some of the challenges you're facing? What's the biggest challenge you face on a day-to-day basis?
I think it's that education. I think the education of individuals and businesses. We also work with businesses to provide services, and the same thing that we do for individuals, but sponsored by employers. So whenever we go out and talk, 2 years ago, it was really, really hard because people had never heard of this before. And again, I'm sure some people still think I'm crazy, but most people thought I was crazy then. And so just having people stop and think about their healthcare and their health insurance and the best way for that to be arranged is a big challenge. And if another physician who's thinking about doing this, I won't sugarcoat it and say like, oh, you're just going to be able to open your doors and people are going to flock to you. No, you got to go out and you got to talk to people and lay that groundwork before you're open. And I've seen some other physicians open practices like this, and for numerous reasons they fail. And one of the big reasons is because they think that people are just going to find them and they can charge lots of money because they're a doctor. And they honestly overvalue what they're providing. And that sounds weird coming from a doctor, but a lot of doctors doing concierge medicine who are charging thousands of dollars a year. Yeah, there's a certain small percentage of people who are going to be willing to do that because, well, you can probably sell oranges at $10 a pop and some people will buy them. But most people are not going to be willing to do that. The biggest challenge is obviously getting new patients and educating people about what you're doing and why you're doing it and why it's good for them. In terms of like internal stuff, there's always, any business has, challenges internally. And so the cool thing is that we can adapt. I've changed the way I did things. I've kind of changed over time the way we've done some of our pricing, but it's easy for us to do that because it's just me and another person. And I'm kind of the decision maker. For us, we're nimble. We can make decisions. If we do something one way and we say, you know what, that doesn't work, it's really easy. I say, let's do it different tomorrow. Whereas in a normal practice, even a small group practice, there's big meetings and people have to go back and forth and there's various factions. But for us, those type of things are really simple. Like, hey, that didn't really work well. Let's do it this way. And we do it that way. And, over time, we, of course, evolve our internal policies and practices. But operating in this manner, it makes that pretty easy compared to a normal medical practice.
I guess going to a little more of what you said, that you've seen doctors start these practices and fail. What are kind of the commonalities you see among the people that have failed? What would you attribute that failure to? And what about what you've done has been different? What have been the keys for your success? And what do you think are kind of the keys to failure or the pitfalls to avoid?
Well, I think there's a lot of factors. And whenever I speak about this, I do say there are always local issues that matter a lot. And so whenever I give advice to a doctor or tell them how I've done things, the way that I do things here in Lawrence, Kansas, it may not be the absolute best way to do that in San Antonio or a smaller town or a bigger city. So I think there's some things that are hard and fast rules on overarching ideas. But I also think that you have to look at your community in terms of how you do your pricing, and all of those factors are going to depend upon some local factors. But I think for the most part, the doctors who have failed doing this is they've overvalued their service. And that comes in many forms. Number one is they charge way too much money. And number two is they don't give people much in return. So I try to provide as many services and sweeten the pot as much as possible for people to join, because they're paying me a monthly membership fee. So if people don't feel like they're getting any value out of that, then they're not going to continue. And sometimes there's nothing you can do. But for most people who are thinking about it, they need to see a return in their value. And so sometimes that's an ongoing, monthly thing. Someone with a chronic disease, if I can give them labs for free or really cheap, and I can do their medicines 90% less, they would be crazy not to continue with me, because I'm saving them more money than they ever pay me. And so the thing is, you have to step back and think about it from the patient's perspective, is what are they getting for paying you?
So if you could say only one thing to a physician that was considering moving into a model similar to yours, either they're in the process or they're thinking about it, what's kind of the one big piece of advice you would give them?
I would say, again, this might be repeating myself, but start laying the groundwork in your community and education effort and marketing, or whatever you want to call it, long before you open your doors. I think a lot of docs they're kind of slow to do that. They kind of decide on their EMR, and they decide on their office space, all the details and who they're going to hire, and really haven't drummed up business. And that's the hardest thing. I mean, the first 6 to 12 months are by far the hardest. And some people grow faster than others. But if you start off with 0 patients and 0 interest and 0 conversation in your community about your practice, it's going to be very, very hard to survive that first year or two. I did that a little bit. I wish I would have done that more. I wish I would have started 6 months, not 2 or 3 months before I opened my doors. And again, obviously, if you're 6 months out, you're not going to be signing up patients. But you can get that conversation started, and you can get people talking about you. And so that when you do open, there's going to be some awareness about what you're doing. And I've seen a lot of other docs who kind of open their practice. They worried more about internal stuff. They open their doors, and then they decide, hey, I probably better tell people who I am and what I'm doing. And I think that's probably one of the biggest mistakes I've seen people made, is they kind of open their doors and then realize they don't have a built-in referral stream. If you're transitioning from an existing practice and community where you're well known, that in some respects is a lot easier. It does come with some challenges. But if you're starting in a new location, or you're not, kind of going to be expecting a lot of your current patients to follow you, then it's something that it's really important to kind of lay that groundwork well before you open your doors.
That's a recurring theme that's come up a lot with the people I've talked to. And I think it's a recurring theme with small business owners in general. I think like most small business owners, doctors are really skilled practitioners, and that they understand their craft and how to help patients and how to take care of people, but not necessarily how to sell and market. They tend to focus more on that. There's actually 2 good books I'll recommend if you or someone else are Ready, Fire, Aim, and The E-Myth. I'll link to both of those when this show goes live, but kind of about building your business in such a way that you actually have the customer demand and customer generation, because obviously you've got the fulfillment built out. You know how to take care of people. But I know that's the most recent project I worked on was kind of similar. It was totally unrelated to technology product, but they basically spent a year building it without ever doing any sales or marketing, and then it got to market, and it was just kind of a kerplunk. There wasn't a lot of action going on, and so you got to start kind of all over again with the marketing.
As doctors, we're very uncomfortable, quite frankly, about talking about these type of issues, because I don't know exactly where this comes from, and I have theories, but like we've kind of been taught along the way that it's kind of dirty and beneath us to talk about money and insurance and business, honestly. I think a lot of doctors just feel like, I'm a doctor, I'm not going to get involved in that stuff. I'm going to do these injections, and I'm going to prescribe these medicines, and everything else is going to take care of itself. Maybe that would have worked 80 years ago before the system was messed up. But I think that if you're going to be successful, you're running a business, you have to think about it like that. And again, I think there's this really weird idea that somehow thinking about your business and the money of it is somehow like interfering with your capability of taking care of your patients. And I think it's the exact opposite. Again, I might be a weirdo, but I feel like if I'm talking about money with my patients, including the tests that we're ordering, that it's providing better healthcare. I think there's a weird notion that all that stuff should be not thought about. We should not think about value in healthcare. We should just do what's best for the patient. And healthcare things are never that simple. There's always considerations of order this test, that test, do something, do nothing. And cost should be a part of that conversation. Again, there's certain situations you get run over by a bus. Yeah, no one's going to want to think about cost at that point. But that's not 99% of healthcare is not those type of issues. It's stuff that should be talked about before it's done. And I'm a huge proponent of just transparency. And there's a lot of organizations out there that are supporting that effort. And whether you operate in a direct model or not, it makes it easy for us because that's kind of inherent to operating directly. But I think having those conversations and saying you're educating or marketing to a doctor seems they don't want to be viewed as some type of business person, I guess.
Yeah, I think a lot of marketing gets a bad name because people kind of equate it with this like food companies pushing, sugary drinks on people, or billboards or the Super Bowl advertisements. And I think the way you said it, kind of what you're doing is you're educating people. It's not deception and trickery. You have this service and you're just explaining to them how it works and what the potential benefits are, and then you're letting them make the best decision for themselves.
Yeah, absolutely.
Well, Dr. Newt, that was great. It was great speaking with you. If people want to get in touch with you, what's the best way to do that?
Our website is probably the best way to go about that. Our website is neucare.net, NEUcare.net, or if you Google NeuCare, you can find us. And you can obviously learn a lot about our clinic. And if you want to send me a message, it goes to my email there. So contact us through the website. And like I said, I'm always happy to talk with people, whether they're interested in starting up a practice or just, curious. Or I talk to patients around the country who find out about me through some source. And so I'm always happy to talk to people about what I'm doing, because I think at the end of the day, doctors who are operating into this model, we kind of need to work together and help each other out, because it's going to take a large concerted effort for other doctors to start on this path. And so I'm definitely happy to talk to anybody.
Well, excellent. Thank you, Dr. New. It was a pleasure speaking with you.
Thank you.
You can go to conciergemedicineradio.com to get this episode's notes and links to everything we've talked about, as well as the entire back catalog. For those of you working on bringing in new patients or retaining existing patients in your direct pay or concierge practices, we've also got a new report on the 5 keys to marketing for direct pay and concierge physicians. After asking physicians across the country about their biggest problem, I kept hearing the same thing come up. Patient education and marketing. How do we help patients understand what we do? So I put this report together after interviewing dozens of the most successful concierge and direct pay physicians across the country for the stories and tactics on how they've been able to generate dozens of word-of-mouth referrals each month, find more new patients through speaking opportunities, get featured in their local press, and use their website and online presence to educate their patients and grow their practice. So if you'd like to read their stories and see how to use them to help grow and retain more patients in your practice, you can download that on our site. Talk to you next Tuesday morning.
Thanks for joining us today at Concierge Medicine Radio. If you found today's show valuable, we'd love it if you spread the word by leaving us a review on iTunes or sharing it with your friends. To see notes on today's show, please visit us at conciergemedicineradio.com. While you're there, leave us your email to hear about all upcoming episodes.